Yes, thank you so much, Lars. Thank you very much for inviting EuroHealthNet and myself. I'm really honored to sit here today and talk to you about our work at EuroHealthNet and our work vis-a-vis the EU policymakers, the governments as well, together with our members across Europe. In my presentation, I will not try to limit myself, but just to kind of stay a little bit focused on diving into the processes at the EU level, and notably taking under the loop the EU for Health program, and also the European Health Union, so post-pandemic, a kind of vision for where we want to be in terms of health across the continent with our member states. And I will try to kind of maybe assess a little bit whether those processes, the mechanisms, the tools that are there are actually on track to enable all of us, all of the member states, all of the organizations that constitute the public health, I'd say, ecosystem, to transition to an EU-wide economy of well-being. So it's not only within those countries that are in the EU that are pioneering, but that the movement maybe shifts a little bit to the east, also incorporates the countries from the Central Eastern European region, but this is to be seen. Okay, next slide, please. For those of you who don't know who we are, just very quickly, EuroHealthNet is based in Brussels, Belgium. We are a not-for-profit European partnership for health, equity and well-being. Very easy. Our members, at the moment 63 in 25 European countries, are mostly national public health institutes and authorities, regional and local health agencies, research and practice organizations. So going from very, I'd say, national through regional to local level. And we work within the partnership and a variety of stakeholders outside in three kind of, I'd say, platforms, which is policy. I'm a lead for the policy platform at EuroHealthNet, monitoring, surveying what's happening at the EU policies horizon, not only within the health policies sector, but actually much wider than that. Practice hub, I'd say, actually, and a research. So I kind of trying to translate or enable this the transition from a policy to practice and vice versa, and research and those processes with our members really at the center. Next slide, please. Why the economy of well-being approach is a very promising approach, actually a framework for us, for EuroHealthNet to work with. It is because all of the issues, all of the kind of approaches that the economy of well-being, as really nicely presented by Catherine just 5 minutes ago, enable us, our partnership, and encouraging our partners outside to help build healthier communities and tackle health inequalities within and between the European states by addressing the determinants of health, but very much so these upstream structural determinants of health. So we, for example, in our only this June adopted strategic development plan for the next 5 years, our members decided we are going to work on health equity, really top priority, non-communicable diseases, climate crisis, prevention and promotion, and across life goals out of it. And then we will also focus on 2 cross-cutting topics, which is the digital inclusion, the digital determinants of health becoming like really being put to the forefront in all the discussions on delivery of health and social care, and mental health, so psychosocial aspects of our living and working conditions, for example. Next slide, please. So where it all started, I mean, Katrin already hinted it a little bit. People, communities, organizations started, feeling kind of dissatisfied with what's happening. The economic model is not working. We've seen a very similar thing working at the EU policies level. There was a sense of dissatisfaction with the previous commissions, the European Commission's economic growth and jobs narratives. I'm talking here about the two previous commissions under Barroso and Juncker. We have a new one now, led by a woman for the first time. So, there might be some positives of that to be seen. Still, I'm going to talk about it a little bit later. There's been a lot of work happening at the pan-European level on social investments and social infrastructure, and this including health investment needs. There was, for example, a very recent analysis from the Commission itself, stating that every year we are facing 22 now in the post-pandemic context, 70 billion euros a year gap in health investment needs. So this is how much money we actually need, and this vis-a-vis this kind of really persistent and not helpful, I'd say, 3% health budget being dedicated to health promotion, disease prevention at the EU level. Of course, some countries are better than others, but that's the kind of average. Another thing, figures, not a very favorable figures on the economic cost of health inequalities. Only 10 years ago, in 2011, it was assessed to be 980 billion euros a year lost, I'd say, because of inequalities in health. It's 10 years later. We have a pandemic. Syndemic. It might be more, and this is what we expect. There are no reliable, I'd say, estimates yet, but this is something very, very likely to emerge very soon. Unsustainable lifestyle, preventable chronic NCDs, mental health problems, climate emergency, poverty, austerity, a lot of things that people start to think, hey, it's really not working. We want a change. Our work, what we do in Brussels and across Europe with our members, is possible because of the operating grant that we received from European Commission's Director General on Employment and Social Inclusion, so actually not from health, to be honest, which actually is quite helpful because it enables us really to address inequalities in health from this socio-economic, environmental, digital, political, cultural, commercial determinants of health perspective. We've been able to work on a couple of Horizon 2020 research projects, notably one of them, and I will tell you a little bit about it a bit later, called Inherit, on triple wins, so the win-wins between investing in health, equity, and environmental sustainability. But really the work with the economy of well-being concept and approach started when it became a priority for the Finnish presidency, actually, of the Council of the EU back in 2019. Which enabled us to kind of start vocalizing our messages. And I really liked what Lars said before. I was listening to the Danish conversation. What gets messaged gets done. So, there were council conclusions on the economy of well-being, which proposed a number of interesting initiatives and called on the European Commission to do stuff on the member states. So we are still kind of following from that. I mean, unfortunately, and maybe fortunately, the pandemic happened, which gave us a new momentum to build back not only better, but further in ways that promote well-being for all. Next slide, please. So where is it going? I was asked to give you a little bit of a kind of sense or a feeling whether what's being proposed from the European Commission perspective, and here mostly I'm talking about DG Santé actually, and higher level, the cabinet level of the president of the Commission, whether this is actually going to put us back on track of building back further with this economy of well-being put centrally. And there are several processes and tools that can be helpful and certainly are helpful. But of course, this could have been done so much better, and that's why it's important that we are vocalizing, bringing the evidence together and transferring it higher up, so that this gets reflected in all the policy decisions taken and investment priorities being made of where the money goes to. So the most important financial package, for example, that we have for health at the moment for the next years until 2027 is the EU Health Programme, which consists of really a huge budget of 5.3 billion euros. Just to give you, just to put it in a perspective, it's more than 10 times what we had until now. And it's to implement actions in 40 areas that you can see below. Our question was why reducing inequalities in health was not made a main objective, like it was done actually before in the 2014-2020 health program. It's not there anymore. So what's not instead, but what's more prioritized is reducing the burden of NCDs and chronic diseases. Yes, through health promotion, disease prevention, but mostly from this lifestyle perspective, addressing serious cross-border health threats, issues related to availability, accessibility, and affordability of medicinal products and medical devices. So a really strong biomedical approach to seeing and understanding health. Strengthening health systems, but mostly from reinforcing health workforce, the digital transformation of health care systems, organization and delivery. What's not in our own assessment is addressing inequalities along the social gradient, stronger links between climate crisis and a human health impact. So this One Health, planetary health approach, and integrated and community-based care within the public health and social, I'd say, systems. So what we see is this risk of fragmentation and disregard of social conditions and policies. Is it ambitious and forward-looking and resilience building enough? So in our view, not yet. But other processes and mechanisms and tools could kind of improve the situation. And here we are, for example, looking into a tool that's available at the EU level called the European Pillar of Social Rights. And it's accompanied by an action plan in a number of areas. There are 20 principles on how we all, as the EU, as the member states of the European Union, can prioritize a number of areas and healthcare, but also fight against poverty, social exclusion, education, and so on, can bring us more and move us onto the way to the strong social Europe, and perhaps that would also enable us to employ more of the economy of well-being approaches. Next slide, please. Yes, so I just wanted to kind of bring it a little bit, in an essence together, advocating, or keeping on maintaining the advocating for better health for all, and the economy of well-being at the EU level is really important. We think it's to learning to navigate this world of commerce, politics, and finance, to really take the work that's being done in all the hubs across your countries that you're from, and perhaps also encourage the countries who are not there yet, but might be looking up to today more advanced colleagues to sparkle this enthusiasm, as we see here, and take it in their own hands and move on. There have been some successes. We have to say health equity is better taken up. It's better it's higher on the political agenda, like in a more kind of mainstreamed, I'd say, way. Although still from this narrative of health of vulnerable people, disadvantaged people, rather than from a social gradient perspective. So there's still some work to be done. The economy of well-being is slowly entering the vocabulary of the EU policymakers, and but of course more has to be done, and we are looking for ways to do so. The challenges are that there's a constant change, and we have to re-educate key EU policymakers coming from totally different sectors into the health sector, and sometimes really from a defense and space sector, as it is the case within the DG Santé, the DG dealing with health. CSOs and NGOs here in Brussels are small, only limited to a certain number of people working. There are difficulties with operating grants. We are grateful actually that we have the DG employment grant, but there have been problems, I'd say, with operating grants for functioning for the NGOs in the field of public health. It's perhaps going to look a little bit better, but still the details have to be discussed. So advocacy and working in alliances remain really crucial to really make sure that people understand that there's more to health than investing in healthcare and hospitals, and that health promotion means more than campaigns that encourage healthy lifestyles. This is what we see, this is what we deal with every day. So this kind of systems thinking, changing the mindsets of governments, but also the EU policymakers, is still very much something that we want to work on. Next slide. Yes, so this is just to, I know the time is running out. This is just to kind of visualize it, how we see the work going on. So there's this top-down approach, member states, the EU, working on this enabling framework, and then using what's being done at the ground level, really to meet in the middle, and put the economy of well-being in practice. Next slide. I had a couple of examples of how we are doing that with EuroHealthNet, but maybe we can also leave it for the discussion later. We are working on the positive health concept. We have participated, or we led on the Inherit projects that I mentioned previously, which was bringing really together the health, environmental sustainability and equity together. And the results of this project we are still really using in discussions around European Health Union, EU for Health, but also working within the European Social Fund and social investments at the EU level. Next slide. We have, this is an ongoing work still, we have an EU guide, e-guide for financing health promoting services that can be available, can be seen on our website, that really kind of tries to build capacity of different sectors, different stakeholders and organizations to advocate for and really a kind of get the know-how to make the solutions for health enhancing services and systems as investable, I'd say, attractive for the investors as possible. And the rest I will just leave for now because it's too much of a talk. Next slide, I think it's thank you very much. I'm here. I'll be very happy to discuss, to answer the questions. You can also contact me after the presentation. Thank you.